Welcome to the Startup Grind.
Hi. Can you guys hear me all right? Thanks for the intro, Nikhil. I'm really excited to kick off the social entrepreneurship track here at Startup Grind, which is very cool. And I know many of you were expecting Lila. Lila and I actually co-founded Samahope in 2012, early 2012. So I'm here to tell you a little bit about our journey in creating Samahope and what we've been up to. I'd like to start by telling you a story about this guy. So this is Dr. Shankar Rai. I actually met Dr. Rai last year in Nepal. Dr. Rai came from really humble beginnings in a small village in really rural Nepal. He was really ambitious, very smart, so he made his way to become a doctor, then a general surgeon, and then ultimately an award-winning, really world-renowned plastic reconstructive surgeon. Now, Dr. Rai could actually earn a really well-earned living catering to the higher income population of his country. As you can imagine, plastic surgery, there's a lot of money to be made. Instead, Dr. Rai has actually dedicated his career to reaching the poorest of the poor in his country. He exclusively works on cleft palate and cleft lip repair and burn surgeries. He treats patients like Bishal. Here you'll see Bishal, 2-year-old, from the eastern hills and mountains of Nepal. This is an area where it gets really cold at night. And you can imagine during the cold winter months, when you have no access to electricity, no access to the grid, and only a small fire to use as your only heating source, one of those nights, Bishal actually crawled into that fire seeking warmth. And unfortunately, as a result, Bishal suffers from burns on his face, on his arms, and other parts of his body. Now, he sits in the arms of Basanti, his mother. Basanti is the only caretaker for Bishal and his sibling. She is the only income earner for the family. And she knew that without treatment for Bishal, he was destined to a life of deformity, disability, probably wouldn't be able to go to school, and a really shortened lifespan. This wasn't the future she had hoped for Bishal. And so she said, I'm gonna go find treatment. She found Dr. Rai, and thanks to that, Dr. Rai is now able to treat Bishal, and Bishal is on his way to recovery. Dr. Rai sees patients like Bishal every day. And actually, the interesting part is he says he could treat 100 more patients like Bishal, but he just needs the funding to do so. The aha moment for me came when we realized there's thousands of doctors like Dr. Rai. There's so many doctors out there who are trying to bridge the access to basic health care, but they lack the funds to do it. And more so, these are doctors, nurses, community health workers. They're not fundraisers or marketers. And frankly, they shouldn't be. They should be dedicating their time to reaching more patients, not in trying to raise funds to do so. And that's where Samahope comes in. We think about the power of the crowd and how we can enable a new community of donors, new community of change makers who can really, through dollars at a time, impact thousands of lives through pooled donations together on our online crowdfunding platform. That's what Samahope's all about, but we have a little bit of an interesting journey getting here. So when we started back in fall of 2012, when we launched our public site, we actually launched with a campaign on Indiegogo. So we crowdfunded for a crowdfunding site, which is kind of meta, but was really fun, and we had a lot of lessons learned from that. We launched with individual patient profiles. So our medical partners in the field, they put up profiles like the ones you see here, where they had individual patients, which had photos, and in-depth stories of each of the patients. These profiles and stories consisted of information about what the condition was this patient was suffering from, but more importantly, what the patient hoped to achieve once they received treatment. We wanted to be really aspirational. And this was great. It resonated with donors. There was an emotional connection there. People really responded to this. And 6 months later, we hit our first small milestone. We funded 100 patients. We were able to treat 100 patients thanks to donors on Samahope. This was a small win for us. But we started to think about how are we going to get to the 1 million patients treated? And how are we going to do it in maybe 5 years? That's a big scale question for us. And so we took a step back and started to think about, well, is this the right model to get there? Are we going to get to the 1 million doing these patient profiles? So in the spirit of refinement and iteration and constantly asking questions, we started to talk to our stakeholders. We talked to our medical partners, the patients receiving the treatments, and our donor base. And we learned a ton. I'll highlight 3 things that came out of those discussions that are really relevant here. The first is, from our medical partners, we started to hear that the creation of these patient profiles are actually pretty cumbersome. It takes a lot of time to capture these photos, these stories, and then to follow up with the patients on an ongoing basis, when many times these patients live 4 to 5 days worth of travel away from these really rural areas already, where these clinics are already placed in these rural communities. So that didn't feel like that was a really scalable solution. Second, our donors, while some of them, our patients, while some of them really wanted to tell their story and be advocates for the condition they were in, that wasn't universal. There were some communities where there was big distrust from cameras, of photography. There was a fear of exploitation given past experiences with organizations. And we started to really question how we were upholding the dignity of our patients and protecting their patient privacy. We wanted to treat these patients the way that we would want to be treated, and really thought, okay, we could do better in this category. The third point of feedback came from our donors. So while donors loved the emotional connection that came from these patient profiles, they also sometimes felt like, wow, this is a sea of hopelessness. There's so many patients. How do I pick which one to help? And what's really my engagement? After I fund a treatment, now what? How do I keep engaged? How do I keep connected and keep making impact? So all of these points together really helped us think about, okay, what are we going to do that's going to really help us scale? And then I thought back to the stories of Dr. Rai and the stories of our medical partners, which are really at the heart of each of them. We have these amazing doctors, these nurses, these midwives, these health workers, who are all inspiring and really unsung heroes. Let's tell those hero stories. Let them tell us what are their challenges in delivering global health care. Let the donors get connected to these doctors and build a relationship with them. So that led to Samahope 2.0. This is really where we profile and feature the doctors on our site. This model scales a lot better with our medical partners. It develops a long-term relationship that donors can have, and it preserves the privacy of our patients. And the crux of the site, here are a couple of screenshots of the site, is really these profiles of the doctors. Each of these profiles have information on credentials of these doctors, what their excess capacity is, what that number looks like, where they're treating, the breakdown of costs for those treatments. And the big question for us was, okay, how are we going to get that emotional connection still with these doctors? And so we found, actually, that video is a really great medium. So every single one of these profiles has a 1 to 2 minute video of the doctor, where you can really hear from the doctor himself or herself what inspires this person. Why do they do the work that they do? And what is it that they need? What are their challenges that they face on a daily basis? From a donor perspective, when you come visit the site, you browse through these profiles, and then you can decide, okay, I'm going to support Dr. Maggie here. And you have the option to donate on a one-time basis or on an ongoing basis through a monthly subscription. Kind of like the amount you spend on a Netflix account, you can actually you can actually support a doctor to save lives. And on the back end, all the donors get reports from each of the doctors on a monthly basis. Here are the actual names of the patients who are treated as a result of your support. Here are the outcomes of those treatments, and updates from the doctors on an ongoing basis about, here are some of the successes I've had, here are some of the challenges I've had, so that you really have this relationship that you're building as a donor. Now, at Samahope, we really focus on what I like to call high-impact, low-cost treatments. And to give you a sense of context, our treatments range from about $50 to $1,000. And so this is pretty affordable to change a life. And our costs are fully loaded. What that means is the costs include things like outreach and transportation for the patients, food, hospital stay, recovery period, medicines, and the actual treatment itself, and in some cases, the training for the actual health workers and surgeons and doctors who are actually providing the treatments. The areas that we focus on are really important to us, and we've picked them based on feedback from our medical partners. These are conditions that are really neglected by the traditional global health funding sources and are often not really talked about. So for example, I'll highlight burns for a second. I was staggered to hear this statistic. There are more women who are severely burned each year than are diagnosed with HIV and TB combined. why don't we talk about this? Why don't people know about this? And so at Samahope, we not only want to direct funding to these different areas of need, but also try to build awareness about these different conditions. So over the last 5 months, the team has grown from just me to a team of 4. We've relaunched the website and done a whole redesign of our model, and we've grown to a community of over 7,000 donors. So now, looking onward, we're all about growing this donor base and reaching those 1 million patients that we hope to treat, and actually thinking about how we can scale our model here in our own backyard, here in our communities, helping community clinics that are supporting the poorest of the poor in our own communities here in San Francisco Bay Area. Thank you, and enjoy the rest of the session.